Though the risks associated with modern-day anesthesia are very low, these risks can be reduced even more when pre-anesthetic blood work or other tests are performed. In many cases, you may be given the opportunity to accept your veterinarian's recommendations for the tests that are needed or decline them. In order to make an informed decision, it is important to understand why these tests are so helpful in making your pet's anesthetic and surgical experience successful. Before any anesthetic procedure, a complete physical exam is performed to determine the general health status of an animal. Unfortunately, a seemingly healthy animal may have hidden health problems that may only be discovered by performing blood tests. Pre-surgical blood work helps your veterinarian to evaluate the internal organ function of your pet prior to administering anesthetic drugs. Often these diagnostics allow detection of hidden diseases and will also provide information which may influence the anesthetic protocol that the veterinarian may choose. Based on the information discovered, the decision may be made to postpone or cancel a planned procedure to allow for the resolution or treatment of abnormalities discovered on the blood test. There is a wide variety of testing that can be performed. The specific tests requested by the veterinarian are dictated by your pet's age, breed, and general health. A common test performed is a complete blood count, or CBC. The CBC provides the doctor with valuable information. It allows detection of anemia, dehydration, infection, possible bleeding tendencies, lowered immune function, or the presence of parasites in the blood. Another common pre-anesthetic blood test that is performed is the chemistry profile. Such profiles are normally groupings of 6 to 15 individual tests that evaluate specific organ function or health. These tests are like a window into the body that can allow your veterinarian to detect early or non-clinical stages of disease in an apparently healthy animal. As with many diseases, early detection often means a greater chance for successful treatment. Many anesthetic agents and drugs commonly given must be metabolized by either the kidneys or the liver to be removed from the body. When organ function is compromised, the anesthetic agents may have a prolonged or more pronounced effect than intended. Electrolytes and minerals are required in very specific ratios in order to perform their important functions throughout the body. Imbalances in electrolyte levels need to be corrected. Evaluation of electrolyte status prior to anesthesia dictates which type of intravenous fluid therapy is needed to return the levels to a more normal and healthful state. All of this valuable information and testing can be derived from a very small blood sample, often less than a teaspoon of blood. The evaluation of urine can provide useful information as well. Urine analysis can give an indication of kidney or liver dysfunction and may indicate the presence of infection or disease of the bladder or urinary tract. The urine may also provide evidence of diseases such as diabetes. Included in the thorough physical exam your veterinarian will conduct on the pet is a full evaluation of your pet's heart function. The heart is listened to with a stethoscope to detect the presence of abnormalities. Such abnormalities heard include heart murmurs or an irregular heartbeat. The health of the cardiac muscle can also be evaluated with an electrocardiogram or EKG. Prior detection of heart problems allows adjustment of the anesthetic protocol to compensate for abnormal cardiac function and help prevent anesthetic complications. Another consideration your veterinarian may want to evaluate prior to and during anesthesia is a patient's blood pressure. Measuring blood pressure is not nearly as simple to measure in pets as it is in people. High-tech equipment is involved when such testing may be indicated. And finally, the veterinarian may need to take radiographs or x-rays to help evaluate the presence or progression of heart disease, lung disease, or the spread of cancer in cases where a mass is being removed. There are other more specialized tests that may need to be performed before beginning an anesthetic procedure. Your veterinarian will advise you if more thorough testing is needed. When should this testing be done? Most veterinary hospitals have the ability to run much of the testing required in the hospital prior to the procedure. In certain situations, some blood tests may need to be sent off to an outside reference laboratory to obtain results. It is important to remember that the body is continually changing, and results received from these tests are not necessarily going to stay the same over a period of time. If an animal needs to have multiple anesthetic episodes over a period of time, the pre-anesthetic testing may need to be repeated. This will ensure that the veterinarian has accurate and current diagnostic parameters for evaluation. The pre-anesthetic testing your veterinarian may recommend will allow a thorough evaluation of your pet's health, inside and out. When normal test results are documented, not only do we have the assurance of a healthier patient for anesthesia, but we also have an important health record for future comparison as your pet ages. This information helps the doctor to tailor an anesthetic protocol that will reduce the risk factors for your pet. Your pet's health is always the primary concern. Thanks for providing every opportunity to make your pet's anesthesia and surgery a beneficial experience.